Namaste friends, we are doing physiology and functions of temporal lobe and we will do it on 10 point like we have done for occipital lobe and on same heading. The first is physiological anatomy followed by 7 functions, then effect of stimulation of this lobe and finally effect of ablation or removal or lesion of this lobe. Physiological anatomy, this is a temporal lobe and situated below lateral or sylvian fissure. Now, most important part, that is functions of temporal lobe. We will do total 7 functions of temporal lobe. It is mainly concerned with hearing, but then many other functions as well. When first we hear something or get auditory information, first this information comes to primary auditory cortex in temporal lobe, and this part is for reception and initial comprehension. We can say words are encoded here. From here auditory information goes to secondary auditory cortex, area number 42, secondary auditory cortex, and this area is for further level of comprehension. That is, what is the frequency of the sound, what is the intensity of the sound, and after that the auditory information goes to all important area, and that is vernix area, area number 22, and vernix area is for final comprehension of that auditory information. What is the complete meaning of that auditory information? We can also relate this something like we see in the hospital when the patient comes. First, the patient is received by R1 first year resident who receive the patient and start the treatment. So primary area is like that. Then second year resident comes and refine the treatment to secondary areas are like that, and finally consultant comes for final diagnosis. So vernix area is doing something like that for sensations. R3 is also there, but usually because of examination, R3 only comes, we can say, in a complicated case. So here we can say visual information is complicated sensation to decipher, and something like R3, there is angular gyrus between secondary area and vernix area. Anyway, in temporal lobe, we are having primary area for reception and initial comprehension, secondary area for further level of comprehension, and vernix area for final comprehension of auditory information. These are first 3 functions. So we have seen first 3 function with use of diagram. We can see in form of text also. First function is of function of primary auditory cortex, area number 41, that is reception and initial comprehension of auditory information or encoding of words. From here information goes to secondary area, that is the function number 2, secondary auditory cortex or auditory association area, and this area is for further level of comprehension of auditory information like frequency and loudness of sound. From here information will go to all important area for final comprehension, that is vernix area. So from secondary area information comes to vernix area. So function number 3 is of vernix area, that is final comprehension, complete meaning of auditory information. Vernix area do it for visual information also. Additionally, vernix area is also sensory area for speech and highest seat for language based intelligence. Fourth function of temporal lobe is recognition of human faces, and this is done by whole medial half of inferior surface of temporal lobe along with of occipital lobe. Because such a big area is provided, this function is highly developed in human beings. This is function number 4. Let's understand remaining 3 functions. That is function number 5 is of this part, which is anterior temporal pole, anterior temporal pole, and this is part of limbic system. So it deals with all type of emotion and behavior along with memory, learning also, and smell or olfaction also. Second large function, we can say function number 6 is actually common with function of temporal lobe, this area, and this is for naming the object. And finally, we are having below this, we are having area for equilibrium, that is for conscious perception of balance or equilibrium. These are last three functions. Let's see remaining functions in form of text also. Medial half of inferior surface of temporal lobe is for recognition of human faces. Anterior temporal pole, this is, it is written here, this is anterior temporal pole. This is part of limbic system and it is concerned with all the emotion and behavior, also motivation, olfaction and memory. And last two functions are as we have seen in the diagram, area for naming the object and area for equilibrium or balance. After completing seven function, let's see effect of stimulation of temporal lobe and effect of removal or ablation of temporal lobe, which is ablation is also called temporal lobe syndrome, which we can remember by 5 A's. And there is also one more condition associated with ablation, especially if bilateral anterior temporal pole is removed along with bilateral removal of amygdala, then a Kluver-Bucy syndrome results. So we will understand all this with help of same diagram. So temporal lobe is very prone to get stimulated, and obviously if these areas are stimulated, we can expect auditory hallucination along with ringing of ear, that is called tinnitus or vertigo. But then some visual fiber also pass through temporal lobe, which we call Mayer's fibers or loop. Same way, gustatory or taste area is also, although in parietal lobe, but very near to Sylvian fissure. So that also can get stimulated. And anterior temporal pole, which is a part of limbic system, also deals with olfaction or smell. So in addition to auditory hallucination, gustatory hallucination, olfactory hallucination and even visual hallucination can occur, means hallucination related to all spatial sensation can result, and temporal lobe is as very prone to get stimulated. Its stimulation can cause focal epilepsy, which also have clinical features of deja vu, already seen state or dreamy state. So this is about effect of stimulation. If we ablate as per function, we can have many A's. First A can be auditory disturbance, as we can always expect, because vernix area is area for speech. Aphasia can result. So this is second A. Then we are having this some visual fibers are also going. So anopia, especially quadrantic anopia, can result because of ablation. And anterior temporal pole, as it is concerned with olfaction and memory, we can have anosmia and we can have memory loss, that is amnesia. So these are result of ablation or lesions. One more condition happens which is related to removal. Let's see that. Now, this condition is Kluver-Bucy syndrome. This happens when bilateral anterior temporal pole along with bilateral amygdala is removed. First by these scientists Kluver and Bucy on a monkey, and such monkey is called Kluver Bucy monkey. And this monkey resulted or uh, shown with or presented with some very extreme change in behavior, feeding habits, etc. And the major features were fearlessness, no fear left to that monkey, decreased aggression is seen, and extreme degree of hypersexuality also seen. Psychic blindness was seen in that monkey. Normally monkeys are scared of snake, but a Kluver Bucy monkey can pick up the snake and even eat the snake. So eating habits also change towards omniphagia. Whatever may be the previous eating habits, it goes towards eating all the things. And that animal or monkey try to explore anything orally, then wonder a bit, then comes again, forget, and again start exploring even inanimate object orally. So this all are clinical feature of Kluver-Bucy syndrome. So let's see in the text effect of stimulation of temporal lobe. It is very prone to get stimulated. All type of hallucination, ringing of ear, that is tinnitus, vertigo, dreamy state, deja vu, that is already seen feeling, and sight for focal epilepsy. Temporal lobe syndrome we have done using 5A, and these are auditory disturbances, anopia, quadrantic anopia to be specific, loss of smell, anosmia, loss of speech, aphasia, and loss of memory, amnesia. And this we have done in what happens in Kluver-Bucy syndrome. Slide again showing Kluver-Bucy syndrome, and this is amygdala, bilateral removal of anterior temporal pole along with bilateral amygdala result in this syndrome. So that way, friends, we have completed 10 points regarding temporal lobe, especially in related to physiology. Thanks a lot. Jai Bharat, Jai Gujarat.